To get into bed, first you will walk up to the bed using the pattern walker, surgery leg, good leg. Walker, surgery leg, good leg. When turning, be sure to pick up your surgical foot to avoid twisting through that new joint. You will back up until you feel the back of your legs on the bed. Bring your surgery leg forward slightly, reaching back with one hand on the walker, one hand on the bed. Slowly lower yourself down to the bed. When sitting, you want to think about where you're placing your body in relation to the head and foot of the bed. Ideally, you want your head to land on the pillow to avoid repositioning once lying down. To get into bed, wiggle your bottom back using your good leg and upper body to help. Wiggle towards the opposite top corner of the bed to make it easier to lift your surgical leg into the bed. Keep these movements going until you're comfortably positioned into the bed. To get out of the bed, you're going to use your abdominal muscles and upper body to get started. Try to lift your shoulders away from the bed by pushing up through your wrists. You will then use your good leg to help you wiggle to the edge of the bed before slowly turning and positioning yourself at the edge of the bed. Continue to wiggle forward until both feet are comfortably resting on the floor. After surgery, you should never be in a rush to stand right away. Try taking a nice deep breath and make sure your head is clear prior to standing. Place one hand on the surface you're getting up from and one hand on the walker. Lean your nose out over your toes and lift yourself up into that standing position. Once standing, bring both feet underneath you and you're now ready to go. After joint replacement surgery, you may have difficulty lifting your surgical leg into the bed initially due to muscle weakness. Some tricks you can use to help get in and out of bed would be to get your coach or support person to help lift your surgical leg into the bed. You may also use your cane to help lift your surgical leg into the bed. To do this, try to hook your cane under your surgical leg. Wiggle back as you normally would, then use your upper body to help lift in your surgical leg. Keep wiggling until you are comfortably positioned into the bed. The only way your muscles get strong after surgery is to use them, so as soon as you can, we want you to use your own muscle power. You may find these tricks helpful for the first few days after leaving the hospital.